Bismillahirrahmanirrahim. Today my topic of presentation is SDG3 Sustainable Development Goal 3 Progress of SDG3 of Pakistan, challenges faced by Pakistan in during progress. If you are not willing to learn, no one can help you. If you are determined to learn, no one can stop you. Learning objectives of today's presentation is Sustainable Development Goal, its various pillars, introduction, health-related SDGs, SDG3 target and indicators, SDG3 target, Pakistan progress from 2015 to 20, recent advances and MCQs. Learning outcome. By the end of this presentation, participant will be able to describe the Sustainable Development Goal, health-related SDGs, SDG3 targets and indicators, SDG3 target Pakistan progress from 2015 to 2020. Sustainable Development Goal. The development that meets the needs of person without compromising the ability of future generation to meet their own need. The earliest and most accepted definition of sustainable development goal is the meet of the need of present without compromising the ability of future generation to meet their own need. But sustainable development goal is more about more than just the environment. It basically has three components: economic growth, environmental stewardship, and social inclusion. Economic sustainability. It is an ability to efficiently use available resources to ensure profitability over time. Social sustainability is the ability to ensure condition of stability, democracy, participation, and justice, as well as possibility to guarantee the human welfare condition. Environmental sustainability is ability to maintain the quality and reproducibility of the natural environment. The interaction between considered dimension determines a condition of development that can be defined as viable when environment economic pillars interconnected, equitable, social and economic, and bearable when environment and social. These dimensions appear to be preliminary but are also necessary and sufficient for full implementation of commonly shared approach to sustainability. These are three pillars: social, which include diversity, human rights, equal opportunities, outreach program; environmental, compliance, biodiversity, emission to air, water, and chemical usage and discharge; economic, consistent and profitable growth; total shareholder return, risk management. Social, environment, economical. Social include social and environment form bearable, and economic and equitable form sustainable, and economic and environment make viable. History: the 2030 Agenda for Sustainable Development Goal adopted by United Nations member in 2015 provided a shared blueprint for peace and prosperity for people and planet now and its future. Sustainable Development Goals. The SDGs are a United Nations initiative officially known as Transforming Our World, the 2030 Agenda for Sustainable Development Goal. The Sustainable Development Goals are a set of 17 aspiration goals with 169 targets and 304 proposed indicators that are supported by three pillars of sustainability: economic development, environmental protection, and social equity. The transition from MDGs to SDGs. The MDGs is given from 20 to 2015. It has 8 goals, 21 targets, and 60 indicators, whereas SDG is from 2016 to 2030. It has 17 goals, 169 targets, and 304 indicators. SDG 1 is no poverty, 2 is zero hunger, 3 is good health and well-being, 4 is quality education, and 5 is gender equality. This is a goal. It is social include SDG 1, 3, 4, 5, 11, and 16. Economic include 8, 9, 10, and 17. And environmental include 2, 7, 12, 13, or 15. Health-related sustainable development goal. There are 6 goals which address the various key issues of public health, include poverty, hunger, food security, health, education, gender equality, women empowerment, and sanitation. First one is no poverty, second is zero hunger, third is good health and well-being, fourth is quality education, fifth is gender equality, and sixth is clean water and sanitation. Third, good health and well-being. Good health and well-being addresses all major health priorities, including reproductive, MCH, child health, communicable, non-communicable, and environmental disease, universal health coverage, access for safe, effective, quality, and affordable medicine, SDG3 targets. The goal consists of 13 targets. Each target has one or two proposed indicators, with the exception of SDG 3.3 and target 3.9, which has 5 to 3 indicators. With a total of 26 indicators, this health goal SDG3 has the largest number of proposed indicators of all the 17 SDGs. It ensures healthy life and promote well-being for all at all ages. First, target 3.1 is reduce maternal mortality. Target 3.2 include and all preventable deaths under 5 years of age. Target 3 is fight communicable diseases. Target 3.4 is reduce mortality from non-communicable disease and promote mental health. Target 3.5 prevent and treat substance abuse. Target 3.6 is reduce road injuries and deaths. Target 3.7 is universal access to sexual and reproductive care, family planning and education. Target 3.8 include achieving universal health coverage. Target 3.9 include reduce illness and death from hazardous chemical and pollution. Target 3.8 include implement WHO framework convention on tobacco control. Target 3.B is the support research development and universal access to affordable vaccine and medicines. Target 3.C is increased health financing and support health workforce in developing countries. Target 3.8 is improve early warning system for global health risk. SDG has 13 targets and 28 indicators. The first 9 targets are actually outcome targets, which include MCH, communicable disease, mental health, road deaths, and family planning. The fourth means to achieve Last 4 are means to achieve SDG3 target, which are WHO framework convention on tobacco control, support research development, universal access vaccine, and increase health financing and support health workforce in developing countries. SDG3 indicator progress of Pakistan from 2015 to 2020. Good health and well-being is we see from 2015 baseline to 2020. The indicator first is reduced maternal mortality indicator 30, which indicate 3.11 maternal mortality in 2015 it is 178, in 2020 is 148, and its global SDG target is to decrease 70 per 1,000 live births, 100 live births, and all countries 140 per 100,000 live births. Maternal mortality there is decrease in 2020. Indicator 3.12 is proportion of births attended by skilled health personnel. In 2015, its status is 58%, and in 2020 it is and in 2008, according to PDHS data, it is 69.3, and its target by 2030 is not defined. Target 3.2 and all preventable death under 5 years of age. It includes 3 indicators: 3.21 under 5 mortality rate, which is in 2015 79.5, and now there is slight reduction 70. All countries target is to achieve 25 deaths per 1,000 live births. Indicator 32.1 infant mortality 64.6 in 2015, and 2020 57.6 decrease, but there is slight change. All country target is 25 per 1,000 live births. Indicator 3.2 to include neonatal mortality rate, baseline 6.43 in Pakistan, in 2020 41.0, slight decrease. All country target of according to SDGs to reduce 12 per 1,000 live births. Now include target 3.3, which include fight communicable disease, epidemics of AIDS, TB, malaria, neglected tropical disease, and combat hepatitis, waterborne disease, and other communicable disease. It includes target 3.31, HIV incidence among adults from 15 to 49 years of age. In 2015, its incidence is 0.31, and in 2020, 0.2, slight decrease. Whereas there is no defined target of SDG, but SDG follow the UN AIDS target, which is the 0.02 new cases per 1,000 people globally in 2030. Indicator 3.32, which include TB incidence, in 2015 in Pakistan it is 270, and now 2020 is 259. There is also not set target, but SDG 3030 follow the WHO Stop TB partnership, which defined 20 cases per 100,000 by 2030. Indicator 3.33 malaria incidence per 1,000 population. In 2015 it is 8.6, and in 2020 it is 3.9, which is show marked reduction. Globally, its target is 9 cases per 1,000 life. Per 1,000 people. Indicator 3.34 include hepatitis B incidence among olds. It is include 110,974.60 cases, and it is reduced. in 2021 02808, but not so much. And its target is not defined. Indicator 3.35, number of people requiring the intervention against the neglected tropical disease. It is 69,714,319, and it is in 2019 25 234 and 450. Its target is also not defined. Indicator 3.4, reduce mortality for non-communicable disease and promote mental health. It includes indicator 3.41, probability of dying from chronic disease. It is 30.7 in 2015, and in 2020 it is 29.41. And all country targets reduce mortality one third due to non-communicable disease. So Pakistan is slide reduction. Indicator 3.42, suicide mortality rate per 100,000 population. In 2015 9%, and 2020 8.9%, and its target is also not defined by SDG 2030. So slide reduction. Target 3.5, prevent and treat substance abuse. Indicator 3.5, coverage of treatment intervention for substance use disorders. Data is not available. Indicator 3.5 to total alcohol per capita more than 15 years consumption is 0.29 liter in 2015 and 0.34 liter 2018. Data available, so it is increased and there is no marked decrease. Target 3.6 is reduce road injuries and death. It includes indicator 3.61, road traffic mortality rate per 100,000 population. It is still stagnant. In 2015, it is 13.5 and 2013. And its target is set it, but is globally half the number of deaths due to RTA. 3.7, universal access to sexual and reproductive care, family planning and education is indicated. 3.71, proportion of women of reproductive age who have their need for family planning satisfied with modern method. In 2015 it is 47, whereas in 2018 it is 48.6. Its target is also not defined. Indicator 37.2, adolescent birth rate per 1000 women aged 15 to 19 years. It is in 2015 39.88, and in 2020 37.62. So also not mark reduction, not defined. Target 3.8 is achieve universal health coverage. It is indicator is 3.81, coverage of essential health services. It includes 41%, and in 2020 it is in 2019 data available, it is include 45%. And there is also marked increase in coverage of essential health services in Pakistan. Indicator 3.82 also related with target 3.8, household expenditure on health is 0.5% in 2015 and no data available up to 2020, and its target is also not defined. Target 3.9, reduce illness and death from hazardous chemical and air water pollution and soil contamination. Include indicator 3.91, and in 2015 it is 221, and it's 2020 it is 201. So no mark reduction, no stagnant, and no defined target. Indicator 3.9.2, mortality rate from unsafe water, sanitation and hygiene 19.6 in 2016, and no data available up till now. Indicator 3.93, mortality attributed to unintentional poisoning 1.7 in 2015 and 1.6 2020. So same slide reduction. Target 10 3.8, implement the WHO framework convention on tobacco control. Indicator include age standardized prevalence of current tobacco use among person age 15 years and older. In 2015 it is 22.3, and 2020 it is still 20% stagnant. No defined target. Target 11 3.b, sport research development and universal access to vaccine and medicine. It indicator include 3b1, vaccine coverage, which is targeted under second dose of measles vaccine. In 2015 it is 54%, and in 2020 it reduced to 39%. Third dose of PCV pneumococcal conjugate vaccine 80% 2015, and reduced to 2020 75%. DPT3 includes 72, third dose of DPT3 72% 2015, and increased 2020 75. Human papilloma virus recommended dose is no data available and did not define target. Indicator 3.28, total net official development assistance to medical research and basic healthcare. It is $1.57 million in 2015, and it is increased in 2020 3.05.00 million. Indicator 3b13, availability of essential data medicine, no data is available. Pakistan. Indicator 12, increase health financing and support health workforce in developing countries. It indicator include 3.C1, health worker density and distribution. It is in 2015 93, and in 2018 data available it is 1, so slight increase, no defined target. Target 13 includes strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction and management of national and global health. Indicator include 3D.1 international health regulation capacity and health emergency preparedness. HIR core index is measured as percentage of attributed certain core capabilities that have been attained at specific point in time, and these are 20 HR core capacity index 2016 and 2020. In coordination and national focal point function, it is in 2020 100%, and in it is 2020 50%, surveillance 70%, and in then surveillance 60%. So in 13 in 2015 16 there is increase, and then some increase in 2020 and some decrease. If we see maternal mortality rate, so graphical presentation in 1919 it is increased 400 plus, and then 2020 it include 2015 includes 178 reduction, and if we see 2020 it become 148. Skill birth attendance, if we see the 20 data it is 25%, then through very coming years, previously 2017 it is 69%, and deliveries attended by skilled birth attendants it is increased. Under 5 mortality rate in 1990 it is 150 under 5, and then it is reduced up to 2015 79 and 2020 70. Same infant mortality rate in 2050 64, and in 2020 57.6. Neonatal mortality rate also decreased from 1990 and 2015 46.3 and 2020 41. HIV incidence among adults increased. Malaria incidence 2015 it is 8.6, now it is reduced 3.9. Incidence of tuberculosis it is increased in 274 cases in 2000, then it remains stagnant and then decrease also, and in 2020. Incidence of HIV, it is 1990 it is remain baseline, then increase in 2005, and then it is increasing up from 2015 to 2020, but there is slight reduction. Similar incidence rate of acute hepatitis B in older adults in 2015, it is 110 974 cases in 2015 data, and it is a slight reduction in 2019 data 102 808 new cases of hepatitis B. Neglected tropical disease, reported number of intervention in 25 to 34 450, and slight reduction. Probability of dying between age 30 and exact age 70 from any non-communicable disease, it is in 2000 it is 33.47 probability, and in 2019 it is reduced to 29.41, not so much reduction. Suicide mortality rate in 2008 it is 9.1, then in 2016 it is 9, and then it is from 2018 to 20 there is stagnant 8.9%. Pakistan total alcohol consumption per capita increased 0.35% from 0.120. Total alcohol consumption capita per alcohol all increasing in Pakistan. Mortality rate caused by road traffic accident injury in Pakistan. In 2009 it is decreased, then it is start increasing, and in 2014 it is 13.4, and then 2018 it is start reducing. Adolescent fatality rate in 2000 from 2009 to 29, in 2009 it is 42.75%, and then in 2019 it is 37.62%. Universal Health Service Coverage Index is increasing from 2000 to 2018, it increased up to 45%. Population household expenditure in on health, in 2001 it is 0.1%, and in 2015 it become 0.5%. Death rate from air pollution Pakistan from 1990 to 2019. From 1990 there's indoor air pollution, outdoor particulate matter, and 250 up to outdoor ozone pollution in 2019 increasing. If we see overall SDG3, health remains a top priority for Pakistan, centering to healthcare needs of bargaining population. Pakistan infant mortality declined from 74 per 1,000 live in 2013 to 62 in 17. In similar vein, its neonatal mortality rate also decreased. Estimate from 2015 indicate that maternal mortality rate is 178. Improvement in status of maternal and neonatal health are reflective of improved access, provider availability and competency, and strong infrastructure system and policy in Pakistan. And Pakistan is striving to increase its critical workforce from 1.5 to 4.5 per 1,000 person in line with World Health Organization. Key initiative: the National Health Vision Pakistan 2016 to 2025 was launched based on intensive consultation exercise at national level, which enabled provincial health department to contextualize their policy framework with a view to achieving universal health coverage. To bring healthcare services closer to Pakistan population, a number of lessons learned have been identified. The availability of rural ambulance network for pregnant women, establishment of mobile health team, upgrading of BHUs, and promulgation of legislation related to SDGs. But Pakistan need to be working on developing human resource for health is central to achieving SDG, as health system can only function when the health workforce is fully geared toward or overcoming system challenges. Compliance with international health regulations is critical area where Pakistan is seeking support to develop local capacity and system that booster the country preparedness to protect, prevent, and respond to health threats. Priorities and target. In order to make substantive progress on SDGs, Pakistan priorities include substantially increase spending on health, reduce maternal mortality from 178 to less than 130, reducing infant mortality from 174 to 42, reducing fatality rate and improving modern contraceptive prevalence from 3.6% to 3%, compiling with international health regulation, establishing the network of maternal and childhood hospitals, ensuring universal health coverage, improved diagnostic facilities, strengthening the quality and increasing the availability of health workforce, addressing school health and mental health, improving health data generation and utilization. Now, some recent updates. United Nations is supporting the Sustainable Development Goal in Pakistan, and it is Sustainable Development Framework is also developed, which is known as Pakistan One United Nations Program 2018-22. This framework is medium-term strategic planning document with planned result focusing on key in the outcome, 10 key outcome which are identified through extensive consultation with multiple stakeholders and in alignment with Pakistan development priorities. This is given one United Nations Program 320 from 2018 to 2022. It includes a planned focus on 10 key outcomes that respond to Pakistan development priorities. It includes first, economic growth; second, decent work; third is health and wash; four is nutrition; five, food security and sustainable agriculture; six is resilience; seven is educational learning; eight, gender equality and dignity, governance and social protection. The main aim is to achieve development objective that are equitable attained in line with Pakistan's potential so that fruits of development fully benefit all of the people in Pakistan. Tracking Sustainable Development Goal, a case study of Pakistan is published in a Journal of Cultural Heritage and Sustainable Development. The purpose of study is to gather and analyze the information regarding the level of awareness and commitment of public as well as organization of Pakistan pertaining to Sustainable Development Goal. A sample of 500 respondents in total include employees, journal and public is selected for their opinion regarding SDGs. The data has been collected from federal and provincial capital of Pakistan. The findings of study indicate that the level of awareness as well as commitment towards the fulfillment of SDGs varying across the cities of Pakistan according to business volume and their affiliation within the United Nations. The Ministry of Planning, Development and Reform in Pakistan has that Pakistan has prioritized a sustainable development goal, which will enable us to join the League of Upper Middle Class countries by 2030. And the government of Pakistan discussed MDGs with all stakeholders for coordinating and strengthening efforts at federal and provincial level to achieve Pakistan's sustainable development and poverty reduction. The seven pillars of Vision 2030 are fully aligned with SDGs, providing a comprehensive long-term strategy for achieving inclusive growth and sustainable development. Now it is time for MCQs. MCQs 1. The Sustainable Development Goal are collection of 17 interlinked global goals for developing and developed countries. What is the third goal of sustainable development goal? A clean water and sanitation. B, and poverty. C, gender equality. D, good health and well-being. And E, zero hunger.
D.
B.
Yes, D is correct answer. The third goal of sustainable development goal is good health and well-being, whereas first is ending poverty, second is zero hunger, and third is good health and well-being. So delta is correct answer. Good health and well-being. MCQs 2. SDGs were set up in 2015 by United Nations General Assembly and are intended to be achieved by year 2030. The main agenda of SDG is is the example of sustainable development goal, construction of coal power plant, construction of oil refineries, development of well-designed green spaces, increased use of insecticide, pesticide, fertilizer in agricultural activities or landfill through e-waste.
C.
Yes, C is the correct answer because and the sustainable development main agenda of sustainable development goal is to provide the environment so as to protect the coming generation as well. Therefore, the main agenda is that development of well-defined green spaces and decrease the effect of refineries, but judicious use of insecticide, pesticides, and decrease the harmful effect of chemicals and hazardous substances to coming generation. Therefore, the C is the correct answer, which is come under example of sustainable development goal, well-designed green spaces. MCQ 3. Chronic and catastrophic disease continues to be one of primary driver driving household out of poverty and into hardship. Non-communicable disease play a significant impact on human health around the world. How many SDG goals are related to health? 8 SDGs goal, 5 SDGs goal, 7, 6 SDGs goal, or 2 SDGs goal?
B.
B. Um, Total are 17 SDGs, and the 6 SDGs are primarily associated with related sustainable development goals. Therefore, delta is the correct answer 6. MCQs 4. Gender inequality is still a problem in sub-Saharan Africa. It is one of the world's most unequal regions, and progress is much slower than in other areas. The prevalence of cultural norms that exacerbate favoritism towards male. The focus for gender equality is essentially captured in a sustainable development dash goal of the 2030 agenda. ALPA's SDG goal 5, B SDG goal 3, SDG goal 2, SDG goal 4, or SDG goal 1.
A.
D.
D is the correct answer. Gender equality is focused on SDG4. MCQs 5. An ABC developing country reported 23 of adults deaths annually from NCDs, non-communicable disease, chiefly cardiovascular disease, cancer, chronic respiratory disease, and diabetes. The Health Ministry adopts and joins the League of Upper Middle Class Country by SDG 2030 agenda to resolve this problem. Health-related SDGs in ABC country which predominantly focus include Alpha SDG Goal 5, SDG Goal B SDG Goal 3, C SDG Goal 2, D SDG Goal 4, or E SDG Goal 1. Which would be the correct?
B.
B.
B is the correct answer. Yes, the goal 3 is predominantly associated with health-related goals. Therefore, beta is the correct answer. The tobacco epidemic is one of the most serious public health issues in XYZ developing country, resulting in high healthcare cost and the loss of human capital from disease caused by tobacco use. One of the one of the 17 global sustainers to promote health and well-being. The WHO Framework Convention on Tobacco Control is dash SDG3 target. Alpha is dynamic target, B is the means to achieve target, outcome target, D is the output target, and E is the predictive target. B is the correct answer. The SDG3 has actually the 13 indicators, and the last four indicators include the Last four indicators include the targets, include the means to achieve, and the tobacco smoking WHO framework come under the means to achieve targets. Therefore, beta is the correct answer. MCQ 7. For the past 10 years, the chronic and catastrophic disease has been one of the primary drivers driving household from poverty to deprivation in XYZ community. The country should adopt and implement SDG 2030 VN, which is the what is the goal of SDG aimed at eradicating poverty worldwide. Alpha SDG goal 5, Beta SDG goal 3, C SDG goal 2, Delta SDG goal 4, or E SDG goal 1.
E.
Yes, E is the correct answer. SDG goal 1. SDG because goal 1 is related with no poverty, goal 2 is related to zero hunger, goal 3 is related good health and well-being, and goal 4 is quality education, and goal 5 is the gender equality. Therefore, the correct answer is the E, SDG goal 1. Pakistan is first country to adopt the SDG 2030 agenda to coordinate and strengthen effort at the federal and provincial level to achieve Pakistan's sustainable development and poverty reduction target. Dash are the fully aligned with SDGs, providing a comprehensive long-term strategy for achieving inclusive growth and sustainable development. Alpha National Program for Family Planning, Pakistan Beta Pakistan Demographic Health Survey, C Pakistan Vision 2025 Plan, Delta Prime Minister National Health Program, E is Social Action Plan.
C.
C, yes,
E.
C is the correct answer. Pakistan Vision 2025 is fully aligned with the SDG, providing a comprehensive long-term strategy for achieving inclusive growth and sustainable development. Therefore, C is the correct answer. MCQs 9. In developing countries, population growth is much higher while resource consumption is higher in developed countries. The distance between the two ends of spectrum has widened in a similar exponential way. The goal of sustainability is to provide a basic standard of living for all people on the planet. Which of the following option is correct when we only accomplish the three pillars of sustainable development? A is economic plus environmental sustainability make viable. B. Economic plus environmental sustainability or social equitable. Social plus economic sustainability bearable. Delta social plus economic sustainability equitable. E. Social plus environment bearable.
B.
E is the correct answer because social plus environment makes the bearable. MCQs 10. Sustainable Development Goals are a set of 17 ambitious goals that span a variety of complex global development issues. In February 2016, Pakistan National Assembly adopted the SDG as the country development agenda. Pakistan makes significant progress in improvement of dash indicators of SDG3 from 2000 to 2020. Alpha International Health Regulation, Maternal and Child Health, Prevention of Substance Abuse, Delta Prevention of TB, E Prevention of HIV or AIDS.
B.
Beta is the correct answer. Pakistan has made significant progress from 2000 to 2020 in maternal and child health improvement, maternal and child health. So beta is a correct answer, but Pakistan still need to improve and to achieve the 2030 agenda SDG target. Therefore, significant improvement from 2000 to 2020 is the maternal and child health. So beta is the correct answer. Whereas international health regulation, prevention of substance abuse and infectious disease, TB and HIV or AIDS, Pakistan still needs to be work and there is increase in incidence. This is the key of MCQs, references, and thank you.
Thank you very much, Dr. Khansa. You have done a lot of hard work and very nicely arranged the whole presentation, especially your MCQs. They were very good along with the recent advances. And I think everyone has learned a lot from this presentation. If there are any questions, please do let me know. And as there are nothing in the chat box, so we can stop here. Meanwhile, we all pray for all those who are COVID positive right now, and may Allah grant them the whole and complete health, early recovery, and also the wellness without any complications. So with all these prayers and a lot of good wishes for each and everyone in this group, Allah Hafiz, see you next time.
Allah Hafiz, ma'am.